Despite improvements in early detection and treatment, African American women continue to have the highest breast cancer mortality rate in the U.S. But one local clinic is looking to change that.
As News 3 reporter Antoinette Delbel tells us, a medical practice with Secours is taking part in a selective program to help address racial disparities in healthcare.
Overall, I can say I was lucky.
Dr. Moussa Sissoko's decision to go into medicine was driven largely by his experience growing up in West Africa, overcoming polio as a child and seeing firsthand the disparities that exist in healthcare.
I always told myself I'd like to do science to understand this and try to help and do something.
Sissoko says his life work as an oncologist has always been to help bridge the gap in the quality of healthcare across racial and ethnic groups and create a more equitable way to treat those in underserved communities. Now he and his team at Secours Medical Oncology will be able to help address the high rates of breast cancer disparities between Black and white Americans.
The African American woman, the Black woman in general, are 40% more likely to die from breast cancer, for example, compared to their counterpart Caucasian.
The practice is one of only 8 across the country to take part in a health equity initiative that'll identify and break down barriers to access care. Obstacles like lack of transportation, education, and money.
Unfortunately, people will have to choose between going to see a doctor or having something to put on the table.
The 3-year program will ensure everyone is getting the best care possible, no matter the color of skin.
To address your specific issue, whether it is poverty, whether or not look on the skin color, but look beyond the skin color, just as a human being in general.
Helping to create health equity beyond the surface. Antoinette Delbel, News 3.